I am Vaidya Manohar Palakurthi, Executive Clinical Director of MIU, and it's a great pleasure and joy to address a Maharishi consciousness-based approach to health. And this is a very beautiful topic, Maharishi rejuvenation program. It's called Panchakarma. This is very correct time to discuss about the Maharishi Panchakarma or Maharishi rejuvenation therapy. Maharishi rejuvenation therapy is Maharishi's revival and restoration of the ancient Ayurvedic procedures to seasonally purify or restore balance the physiology known as Panchakarma or the 5 actions. Panchakarma means 5 actions. And there is a lot of classical reference. Charka Samhita, Susrut Samhita, Ashtanga Hridayam, Madhava Nidanam, Bhava Prakasham, Purvakandam means first part has given a lot of details, and in Charka Samhita, Siddhi Kalpasthanas, as 2 divisions of 8 divisions of Charka Samhita has explained a lot of details of Panchakarma. So the classical references of Panchakarma mentioned in Charaka Samhita, Sutrasthanam, Siddhisthanam, Chikitsasthanam, Kalpasthanam. These are different divisions of Charaka Samhita, and great references and great formulas and great procedures explained in this Upaveda. Susrut Samhita, Sutrasthanam also explained Ashtanga Hridayam. This is another Upaveda. Madhava Nidanam. This is also one of the 12 branches of Upaveda. Bhava Prakasham also mentioned about Panchakarma and then purpose and also benefits. Today we are going to dwell into very important points, starting with Maharishi Ji's quote. Maharishi Ji explained about the Panchakarma. What is Maharishi rejuvenation therapy? Maharishi rejuvenation therapy is Maharishi's revival and restoration of the ancient Ayurvedic procedures to seasonally purify or restore the balance, the physiology known as Panchakarma. Also prevent the imbalances. Panchakarma means 5 actions. Through the 5 actions. What are those 5 actions? We will see now. Main purpose of Panchakarma. The main purpose of Panchakarma, Maharishi rejuvenation therapy, or enlivenment of gap. Gap means srotas. The body is a network of channels. The whole intelligence is flowing through channels, and then communication, transportation of the intelligence from cell to cell only through these channels. If these channels gets blocked, and then the disease can express, imbalances can express. So enlivenment of gap means purification of these channels and also clarity of these channels. Experience of higher states of consciousness. Once these channels are clear and the flow of intelligence is increased in the physiology, so it's easy to experience the higher states of consciousness. And also prevention of disease, restoration of balance, and rasayana. Rasayana means longevity, prevention of aging, quality and quantity of life. So these are main benefits, but also very direct benefits also I will explain. And Maharishi Ji says, this is very beautiful program for prevention which offers the possibility of creating disease-free society. For heaven on earth, Maharishi Ji explained 2 main important goals. One is disease-free society and total health, both. 2 types of lifestyles habits. One is wholesome habits, another is unwholesome habits. Wholesome habits beneficial to life, unwholesome habits non-beneficial to life. That's why in Charaka Samhita, Sutrasthan explained hita ahitam, sukham dukkham. So this consciousness-based approach to health, Ayurveda, is measuring the qualities or the behavior of individual. What are these beneficial values? What are the unbeneficial, non-beneficial values to the physiology? Based on that, the treatments are given. Health. Health means individual, the consciousness and five elements. The individual is called Shadanga Purusha. Shad means six. Anga means organs. What are the six organs? Consciousness and five elements are made of upper limbs, head, lower limbs, trunk, altogether the individual. So individual consciousness and five elements and the harmony between the consciousness and five elements creates the health. Disease, individual consciousness and five elements, disharmony, disruption in this connection between consciousness and five elements, and this results into disease. What is health in Ayurveda? Susruta Samhita explains unity of consciousness, mind, senses and body. It provides to the individual life balance, bliss and wholeness. A disruption in unity, this consciousness, mind, senses and body, this togetherness is perfect health, and disruption in this unity creates imbalance, misery and disease. Now, evolution of imbalance. So the causative factors from mind and body that are non-beneficial to the life will increase the primordial principles of the dosha, vitiates these doshas. These primordial principles are called Vata, Pitta, Kapha. Then these principles are responsible to vitiate the digestive fire, that is called Agni, and vitiation creates vitiation in the tissues. So body is made of 7 tissues: Rasa, Rakta, Mamsa, Meda, Asti, Majja, Shukra. So plasma, blood and muscle and fat and bone marrow and reproductive tissue. So imbalanced digestion can create imbalances in the structural elements of the physiology, so that imbalance in tissue carrying channels will blocked, so that the flow of intelligence gets blocked and creates the disease, and disease is the process of the disease. So Panchakarma here is to how to remove these blockages, and also how to strengthen the tissues, how to balance the digestion, how to balance the doshas, and how to provide a total health to the individual. Now, this entry of imbalances through two windows. What are those two windows? Mind and body. So, what are these impurities? Mental causes for imbalances for the life, for the individual physiology. Unfulfilled desires, anger, greed, delusion, confusion, jealousy, grief, arrogance, agitation, imbalanced emotions, frustration, hostility. These are the mental afflictions which causes imbalances. And now bodily causes of imbalances: unwholesome behavior, routine, diet, environment to individual body constitution. Results means Prakriti, his nature. Against his nature, anything, behavior, routine, diet, exposure to the environment, non-beneficial to his nature, causes the imbalance. And these imbalances creates imbalance in the dosha, imbalance in the Agni, and it leads to the indigestion, and indigestion creates impurities in the GI tract, that is called ama, and stagnation of these impurities become ama vitiation, and ama vitiation is called auto intoxication. Ama becomes ama visha. Visha means toxins, and spreads to the tissues, disturbed immunity, loss of strength and resistance against the disease. When loss of strength is resistance against the disease. So ama is the byproduct from imbalanced digestion that creates all this disease process in the physiology. Now semi-digested food, ama, that means Agni is vitiated, digestive fire is vitiated, and whatever we are taking, the food is not properly digested and semi-digested, and that stagnated in the stomach and creates the fermentation and creates these impure qualities. What are those imbalanced qualities of that semi-digested food? Improperly processed food creates indigestion, foul smell in the mouth, also in the body, very slimy in nature, excessive liquid feeling, heavy, dense, oily, thready, like the saliva becomes like a thready, and fermented feeling in the throat, and also belchings, fermented belchings. And also the saliva can contain many colors and feeling like obstruction in the physiology. Somehow, any area of the physiology can cause some obstruction. And micro nature of these all imbalances spreads very quickly, ability to cause debility in the mind and body. See, these are all kind of qualities of that imbalanced digestion outcome. The product is called ama, that which stagnate in the stomach creates complete fatigue into the body. So those symptoms is the next symptoms of ama. Ama means that which cannot move. That's the main definition. Ama means cannot move. It's stuck. It causes the heaviness, laziness, anorexia means loss of taste, and excessive salivation, repeated spitting, indigestion. Indigestion could be any indigestion, could be gas, bloating, distension, acidity, also slow digestion, any type of indigestion, obstruction in channels, and channels means feeling like obstructed, something the life force is not flowing. Constipation is also kind of obstruction, obstruction to flow of wind in channels. So vata is moving all over the body, especially gastrointestinal tract. There is vata always moving everywhere, but that flow of that vata gets obstructed and gets vitiated and diverted into the different direction, creates imbalances. Excessive salivation that causes the spitting, exhaustion, fatigue. These are all the symptoms of ama. So when these symptoms could be in three grades, very early stage or medium stage or severe stage. So what is important? Panchakarma to be taken in the early stage. After of this, all the 10 symptoms, if one is feeling more than 6 symptoms, definitely he should prefer to take Panchakarma. Panchakarma is a procedure which helps the clearing the channels and promoting the digestion so that ama will be eliminated. And if it is like 2-3 symptoms, then make sure you taking care of your behavior, diet, routine, exposure to environment. And if it is a lot of symptoms, all the 10 symptoms are expressed, then what is very important? Consulting a right person, means Vaidya, and then trained medical physician, and then evaluation of the symptoms, and then imbalances, and then purification or restoration of balance. Therapeutic rationality of Panchakarma. Panchakarma, we said 5 action, therapeutic actions, eliminates the impurities through the nearest pathway of the body. Number 1 is emesis, upper part of the body, that's chest. Purgation, middle and lower part of the body, the stomach and small intestine. And 4th, basti, lower parts of the body, especially pelvic organs and large intestines and genitourinary system, all these pelvic organs, lower limbs, and everything related to the basti. And nasal administration. Basti means enema. This enema is 2 types. One is oil enema, second one is herbalized decoction enema. The both are cleansing the colon, not only cleansing the colon, and creates a good atmosphere in the colon so that colon can function properly. And colon is very important organ in the human physiology because the bacteria in the colon or the dosha, the main dosha in the colon is vata. Vata is the most important dosha. So balance in colon, balance in vata, and vata can balance pitta and kapha because vata is moving all over the body. That's why vata to be addressed first. Next one is nasal administration. That is nasya karma. Nasya karma means nasahi siraso dvaram. That means nose is the gateway of the brain. So adding some medicinal herbs or the herbal juices or herbalized oils through the nose by the experts, what will it do? And goes to the head and different areas of the head and balancing all the functions of nervous system, functions of sensory system, and functions of ENT, ear, nose, throat, and above clavicle region, whatever the organs are there, and it rejuvenates and also it detox and also it prevention of any imbalances. So what is in this process? The emesis, purgation and oil enema and decoction enema and nasal administration of herbalized oils. What it does? Taking the impurities and from the nearest pathways from the physiology. The emesis, as I explained, upper part of the body impurities, lower part of the body impurities, and middle part of the body from the downward part, and the impurities from the head through the nasya. Benefits of Panchakarma. Now, why we need to do Panchakarma? It is very important to see when we having a car and we take the car every, once in a year or once in a 6 months to the car mechanic. So what he will do, he will check all the car and then make sure car is running well. The same thing, think about the human physiology is a vehicle, it is carrying your awareness, your consciousness. So this vehicle also to be maintained, sustained in its purity and in its strength, in its quality. That's why Panchakarma is very beneficial, like taking care of your car, but very important to taking care of yourself. In Ayurveda, there is an expression, Nagari Nagarasyeva Radhasyeva Radhiyadi Swasarirasya Medha Vikrucheshva Vahito Bhavet. That means how the mayor take care of his city, how the charioteer will take care of his chariot, and the individual, the wise person will take care of his body. If he is not taking care of his body, that means he is not wise. So be wise and take care of your physiology. The whole consciousness-based approach to health, Maharishi says, re-establishing the body with inner intelligence so that body can maintain its purity and its strength and its vitality to bring optimum function and also quality and quantity of life. Next, promotes immunity. Ojas. Ojas is the manifest state of consciousness. When channels are clear and intelligence is flowing. Who is intelligence? Intelligence is the manifest state of Ojas. Ojas is flowing. If channels gets blocked, so that Ojas is also gets blocked. So that's why the intelligence is not available to the other areas of the physiology. There it gets imbalance and disease. That's why Panchakarma promotes the Ojas in the whole physiology so that witnessing intelligence of the Ojas, it is outcome of the balanced digestion and essence of the 7 tissues. Very important tissue in the physiology, and through Panchakarma you can not only opening the channels and promoting the Ojas and also balancing the Agni and also improve the quantity of Ojas also. Prevention of aging. Prevention of aging also one of the main benefit of the Panchakarma because it is the cellular therapy. Don't think of physiology. It goes, it reaches, it's like a microsurgery, goes to the every cell of the physiology, enlivens and in its ability to function fully. So that's why prevention of aging. Promotes well-being and strength of sensory and motor organs, coordination and improved well-being and functions. Sensory organs, motor organs, the 10 organs, and the dual organ is mind. So it promotes the mind, it promotes the sensory organs, it promotes the motor organs and their coordination. Mind, sensory, motor organs. Very important. And stress-free mind and body. Stress-free mind and body, very important. The stress is one of the main causative factor for all imbalances. Resonate self-referral and experience of higher states of consciousness. So self-referral experience and experience of higher states of consciousness, everyone desires for this. So Panchakarma is one of the good procedure to enjoy these higher states of consciousness. Mind, body, tranquility, strength, energy, vitality. Enlivenment of gap means purification of channels and so that Ojas can flow throughout the physiology. Promotion of intellect, very important because how the intellect is promoted through this process of Panchakarma, as Maharishi explained. What is health means re-establishing the connection between the body and its inner intelligence. As soon as the body comes in contact with the inner intelligence, then naturally intellect is promoted. How this is going to happen? Only without any gaps within the physiology. So Panchakarma, the gaps means obstructions. If Panchakarma eliminates all those obstruction and it becomes body very easy to connect with the self, so that intellect is promoted. So that when intellect is promoted, what happens to the individual? The help comes from the self. This is Maharishi Ji explained. My approach to consciousness based approach to health is self help. So he will get all the help from his own self, so that he will enjoy swatantra, sovereignty of the self within the field, within the kingdom of this whole physiology. This is what is Panchakarma will do for individual life. Age and Panchakarma, how it is relationship. Panchakarma is recommended even from the baby, but modified Panchakarma. 1 to 5 years, baby Panchakarma by mother and baby program has explained everything, all those procedures, simple abhyanga and warm bath, also paste massage, like a soap, herbal water bath, fumigation. Fumigation is also one of the procedure in Panchakarma, so that all the bacteria virus will be eliminated. And 5 to 15 years, continue the same treatments. Now, Panchakarma, how it is related to the age. So, age is divided into 3 divisions. First year to 30 years is Kapha age, 30 to 60 years is Pitta age, and 60 to above 100 years. There is no limit 100. 100 is just given. But if one is maintaining that unity, and life becomes eternal, life becomes as long as you want, as long as you maintain that unity. Anyhow, the first year to the 30 years, Kapha predominance, prone to Kapha imbalance. Kapha predominance in that age group, for example, like cold, coughs, congestion, asthma, allergies, and all those things. 15 to 30 years, prevention for Kapha imbalances, massage, Shirodhara, Nasya, Basti, and also paste massage, steam inhalation, all these things are mentioned. And prone to these 1 to 30 years, prone to cough, colds, asthma, itchy skin, weak digestion, overweight, loss of memory, because kapha is increased, then naturally feeling dullness, laziness in the sensory motor organs and the mind. So all these things to be addressed with the above treatments. Next, 30 to 60 years. This is the age of Pitta. Pitta predominance, prone to Pitta imbalances. They are eligible for all the Panchakarma, means 5 actions. 5 actions, as I said, emesis, second one is purgation, third one is oil enema, fourth one is decoction enema, fifth one is nasya. Plus, they are also eligible to do sub-treatments. Sub-treatments are all called like oil stream on the forehead, oil stream on the whole body, and different types of treatments. And like milk pudding, massaging on the body, that's called Navarakiji Pindasveda, all are eligible, the 30 to 60 years. Systems that may be affected. So in this age group, they are prone to certain diseases, even chronic diseases. Nowadays, chronic diseases are coming from any age group, but generally 30 to 60 are more prone to the chronic diseases. And these are the diseases: respiratory disorders, digestive disorders, and water channels like swelling, edema, diabetes, and all those things. 7 tissue channels, as I said, plasma, blood, and muscle, fat, and bone marrow, reproductive tissue channels are sustaining certain function, and also they are prone to certain imbalances. All these imbalance could be addressed through the Panchakarma. 3 mala channels, urine, sweat, and stool, also related normal functions, and also if they are not functioning, then abnormal functions, increase or decrease in their quantity, quality, that creates imbalance, disease, and disorderliness. So cleansing these channels through Panchakarma, and channels of the mind, Manovahasrotas, imaginatory channel. There is no channel for the mind. Mind is everywhere. Mind always with consciousness, consciousness is everywhere, mind, conscious mind is everywhere. Women's special treatment according to that physiological structure, they may need a certain treatments specially, that we will discuss on the next. Now 60 to 100 years, this is the age exactly, very important, the Panchakarma, how to use Panchakarma in the mode of more restoring balance or more rejuvenating, because this age group are aging age group. So their physiology is vata predominance. Vata predominance, generally strength will be little bit less. So that's why one has to be very careful after 60, and not to think I am a champion after 60, I can run and I can walk 2 miles, 3 miles, and I can do exercise, I can eat anything like the middle aged people. But all those things are okay. But what is important, there is a natural law. Natural law is after 60, vata is prone in these people. So doing any simple mistakes in their behavior, diet, routine, even exposure to the environment, immediately vata gets imbalanced. As I said, vata is very important dosha, functioning in the nervous system and sensory system, motor system, and all the movements, especially the aged people. Predominant difficulty is the mobility. So that's why it is very important, Panchakarma. They can also afford 5 treatments, but after 70 years, basically Matravasti, that means oil enema, is beneficial. A lot of people think, oh, I have so much impurity, so I need to do this detox enema. Detox enema or decoction enema is okay. Suppose there is expression, if the cloth is very weak, you try to dye it and the cloth will get spoiled or it could tear. So the same thing, first thing is important, your strength. Second thing is about how to treat the imbalance. So Rogi Bala, the strength of the client is very important. In the after 60s, the strength of the client will be prone to weak. So that's why don't jump into all the treatments. Don't do too many days of the treatments. One has to be self-referral. What is my strength? How much I can afford? It is not like Panchakarma is like a pampering, like spa treatments. That's completely not acceptable. Panchakarma is like a microsurgery. So one has to be very careful. I will discuss that later. Areas that may be affected: intellect, memory, mind, senses, motor organs after the 60s. So that's why these areas are very important. For example, think about first year to 30 years, there are more immune problem. Even though kapha is there, kapha is more prone, and that means kapha imbalance, and immediately immunity gets a little bit disturbed. But balanced kapha, great immunity. But disturbed kapha, difficult in immunity. So now 30 to 60, that is middle age, that is pitta predominance, and that is related to the hormonal systems, all the physiological hormones. That's why hormones are very active and also prone to imbalances. That's why the hormonal systems to be maintained, sustained, balanced. And after 62, above 100 is nervous system. Very important, 3 systems, axis. This axis is neuro, endocrine, immune axis. According to the age, now modern medicine is talking about this, the triple systems in this axis. But who controls these 3 systems? Very interestingly, in Ayurveda it says mind is the responsible for the nervous system, mind is the responsible for the hormones, and also the mind is hormones. So for example, reproductive hormones. What is reproductive hormones? All these gonads and all these different types of hormones. This is all mind. It's not physiology. It's the whole concept of reproductive hormones, and reproduction is only through the mind. That is to be understood. So that's why hormones above 60 is the nervous system, neuroendocrine and immune axis is very important. How to maintain balance and sustain strength in these 3 systems helps the individual life to prolong ichha. Ichha means through their desire. So that's very important. Next, 8 activities to be avoided. This is very important chart. I want everyone to put their attention and listen this. Number 1, after Panchakarma, loud speaking, or during Panchakarma, loud speaking is to be avoided. And after Panchakarma, right after Panchakarma, many people are traveling, and even international traveling, even trying to jump into the plane right away within 3-4 hours before. It's not at all acceptable from Panchakarma. Excessive walking during Panchakarma, doing exercise, yogas, or any gentle things are okay, but not really walking 2 miles, 3 miles, running, and all those things, lifting weights. completely avoided. Excessive sitting also. Yes, simple walking to your treatment rooms and within the house and within the room, you can walk, but not necessarily always sitting. Definitely daytime sleep should be avoided during Panchakarma. But Panchakarma is not easy thing. It takes your energy. If you washing cloth, cloth is losing some energy. Same thing, body also losing some energy. That's why fatigue naturally, that's a very interesting fatigue. You feel happiness, pleasantness, and the simultaneously you feel also fatigue. But when you are feeling fatigue, don't get into sleep. Just try to stay awake. Indigestion due to the eating before previous meal is digested. This is adhyashanam. Adhyashanam means eating meal before previous meal is digested. That means 6 hours difference between each meal. Supposed to be there. So then it will help the process of the Panchakarma. And also after Panchakarma, what happens? Agni is restored. Agni is very tender. Agni means digestive fire. Very tender and very pure and very bright and very enlivened. So you have to be careful. If any purity is there, even small mistake will disturb that purity. That's why it's very important following this eating habit. Eating wholesome and unwholesome foods together also to be avoided. Okay, I'm eating 90% organic foods, 10% frozen food. No, not acceptable. And the day sleep, as mentioned already to you. And indulgence in intimacy, always to be avoided. Definitely during Panchakarma, no question. And after Panchakarma also, better avoid at least 2 to 3 weeks. So that all the restoration of ojas takes place. After PK, the body needs rest. This rest will rejuvenate all functions of the mind body. After washing the cloth, generally we just shake the cloth and take all the wetness and then we'll put on a place where it can get dry. Same thing, after the Panchakarma, you just have to have some rest. So then it will be very beneficial. But most important thing, this is a clinical side, how to evaluation of the client, whether individual is suitable for Panchakarma or not. I'm not going to go through this slide because it's a more clinical aspect. Only one thing I will tell you. What is important to, you need to go through a very qualified physician, one who knows the Nadi Vigyan, so that Atarasya Antaratmanam, through only pulse only, any physician can enter into the physiology of the any client. So that Brahaspati Trigunaji always says, we have to go inside the physiology and dive from up to down, down to up to down, number of times, so that we can know what is happening in their physiology. How it is possible diving into the human physiology. I used to sit with him in the consultation. I used to always get surprised how it is possible, how to dive into the human physiology of another person. So this is what is in Charaka Samhita explained. Atarasya Antaratmanam. When you are taking the pulse, your awareness goes through your 3 fingers into the field of the physiology of the consciousness of the client, and it will read everything what is there, and then it comes back to his awareness. That is the way it is to be diagnosed. The strength of the client, it's the most important thing. Strength of the client. Weak person should not be given strong treatments. If the person is strong and the treatments can given according to the need. This is very important. This evaluation could be done only through pulse diagnosis. One who knows the pulse, without touching the client, giving Panchakarma is lying, throwing a stone in the blindness. That is not going to help any individual. Anyhow, and nowadays it is becoming very popular, and somehow people think physician said or Vaidya said, I need to do 3 weeks, I need to do 2 months, I need to do 3 months. Not correct. All the time is decided by the state of balance and state of imbalance. So the maximum 4 to 6 weeks, a medium 3 to 4 weeks, and minimum 3 days or 5 days or 7 days. But it varies. So that's why it's very important to see a qualified physician and or Vaidya, one who knows the real knowledge of the Panchakarma and the pulse diagnosis. And Maharishi, consciousness-based approach expert. The 6 seasons. So very interestingly, we have 6 seasons in Indian calendar, but most of the countries has the 4 seasons. So that 4 seasons, especially early winter, late winter, summer and spring. So these are the very important seasons. But according to the Vedic calendar, there is two times. One is Uttarayana and second is Dakshinayana. Uttarayana means sun goes northern sphere, and then Dakshinayana means sun goes to the southern sphere. So what is they said? Adana Kala. When sun goes to the northern direction, the energy will be depleted in the individual. And when sun goes to the southern hemisphere, then the energy is more. This is Balakala. Balakala means vitality in the patient. That is the time better to prefer Panchakarma. So Uttarayana, Dakshinayana characters were mentioned. But here, what is this is also very important slide. Ritu Sandhi, seasonal gap. How to understand this Ritu Sandhi? Ritu Sandhi. Sandhi is, you all know, the gap is the most important principle of human physiology. Maharishi explained again and again beautifully in many times. The gap means mantra brahmana your Vedanam Dhyayam. Mantras and brahmanas, syllables and gaps together constitutes the structure of the Veda. The gap is very important because the cell collapse into the gap and emerge into the new cell. So the collapsing place supposed to be maintaining purity. So that's why Panchakarma is going to help to purity of this gap, purity of the channel, purity of the Sandhi, Brahmanas, structuring principle, self-interacting dynamics of consciousness. This gap is very important part of the health. It's a neuronal gap in modern science. They also realized this neuronal gap is the most important for the flow of intelligence. That's why if the neuronal gap is allied with amyloid process, amyloid means that's a degenerative process or some toxic or some substance within the gap, and the gap is impaired, then the dementia, the Alzheimer's disease and loss of memory comes. Very interesting. This is mentioned in Vedic Samhitas long time ago. This is the most important principle. Anyhow, Panchakarma is the most beneficial concept to purify this gap. But how to purify this gap? It is the gap, Ritu Sandhi, seasonal gap. You need to enter into that time for getting purification treatments. How to know this seasonal gap? For example, autumn, and then autumn enters into the early winter. The last 7 days of autumn and the first 7 days of early winter is like Ritu Sandhi, it is gap. It is very important this time in the behavior and the routine of individual to be adapted this time. How to adapt their time and behavior, diet, suppose and expose to the environment. How to adapt the last 7 days of the previous season. Slowly, all that habits, food habits, behavioral habits, and exposure to the environment to be slowly reduced and come to the zero on the 7th day. And again, the next season is early winter. In this early winter, what is we need to do? Adopt the new dietary habits, new behavior, new sleeping habits, new routine habits, and all these things. Slowly adopting first day to the 7th day, come to the normal habits of that particular season. But this is also very important time for the purification. This is the understanding of the Ritu Sandhi. Okay. Now, this is also a little bit technical concept. And here I am going to tell you the strength. Rainy season and summer is low. Autumn and spring moderate. Early and late winter high. And how it is needed time to explain, but just for you to understand. A low, moderate and high, how it is related to the season and also related to the sun in northern hemisphere and southern hemisphere. Northern hemisphere and then loses strength, and the southern hemisphere and gains strength. Even in southern hemisphere of the sun, and what happens in the environment, in the herbs and all those things, Madhura, Amla, Lavana Rasas, means sweet, sour and salty tastes increase. Those sweet, sour, salty tastes are also beneficial to supports the kapha, and kapha is the strength. So that's one point I want to tell here. Anyhow, low, moderate and high related to the season, so that think about your strength and how to select the Panchakarma. Now, 3 stages of Panchakarma. The 3 stages are very important before you go into any medical surgery, the physician will ask you to go through certain tests. Are you eligible for the surgery or not? Pre-tests and blood tests and then X-ray or whatever. The tests, they will do all the tests and then they will prepare and they will give a enema and barium meal, enema or anything, whatever they like to do. They will do that pre-treatments in the surgery, and main surgery will takes place. And also there will be a post-operative care. Same thing, but it is more powerful. There it looks like more gross, all this blood cutting and all those things, even though it is all helping and saving life, but it's a very surface level concept. But what is in Panchakarma? Panchakarma is a very deeper level. It goes to the very, very micro, minute channels and melts the impurities and squeeze the impurities and bring to the gastrointestinal tract, and from their nearest pathway it gets eliminated. And what a difficult, going to the marmas, sandhis, asti sandhis and micro channels. This is what is Panchakarma does. It's like a micro surgery, micro neurosurgery, like that. So that's why it's very important to need to take very important care during these 3 periods. Number Purvakarma, what are the main treatments? Kindling the digestion and then also digesting all any blockages or impurities in the physiology, and afterwards giving some oleation. Oleation is a media. The oil can penetrate through the tissues, through the fat layers and through the microchannels. There are 2 types of impurities: lipophilic and hydrophilic. Hydrophilic means the impurities which fill in the water content and water tissues of the channels. And lipophilic means the impurities that which penetrates into the fat cells, dangerous, all these pesticides and all these, impurities and, space and all those environmental toxins, very easy to get into the lipophilic, because the fat is very important tissue for the amino acids and building of DNA. So it can reach to the DNA and then imbalance at the DNA level and mutation and everything can happen. So that's why it is very important how to enter into these micro channels of the fat channels. Here, principle of similarity. What can enter into the fat? Only fat can goes there. So that's why Snehapanam. Snehapanam means oleation to be given. And so that it penetrates to the micro channels and then melts that impurities, and then afterwards Svedana. Svedana means steam. That steam inhalation, whatever is melted impurities and then taking out, evaporating, and then also bringing out through the skin pores. That is what is called Purvakarma. Very important karma for the success of main treatment. And main treatment involves 5 treatments, as I mentioned, also very number of maybe 50 to 60 sub-treatments or 100 treatments. In this, Vamana karma, emesis, that eliminates the excess kapha; virechana karma, purgation, that eliminates excess pitta; basti, that means oil enema and decoction enema, that eliminates the vata; and nasya. Nasya eliminates all the impurities above the clavicle, above the neck and the head, and also brain and ENT, ear, nose, throat, and also head is the marmasthana. Head is the marmasthana. That's why it is to be treated very carefully. And it is the place of kapha. That means if kapha imbalance, the congestion, density comes into the head. So Nasya Karma is very, very beautiful technique. It penetrates this herbalized oils to the microchannels of the head, and that complicated nervous system, complicated sensory system, complicated sinuses, everything, ears and all those impurities are pulled through this Nasya Karma. And there was one more action included by the Susruta, that is called Raktamokshanam, bloodletting. The Raktamokshanam, Susruta has explained in 3 ways. One is Dahana Karma, means burning, that's the one thing. And second one is Srunga. Srunga means taking a deer horn and then poking and then bringing bad blood out. Then venesection, Chedana Karma. Chedana Karma means cutting the veins, and then our like varicose veins, clogged, deoxygenated blood creates not only big imbalance and pain and ulceration and also losing sometimes legs. So that's why Rakta Mokshanam, bloodletting, all the impurities of the blood diseases could be treated with this treatment. because Susruta consider Rakta is also equal to the dosha, one of the dosha, Vata, Pitta, Kapha. Pitta and Rakta has a so close relationship, but Susruta considered Rakta could be a fourth dosha. But in Vedic literature, the Itihasa, Mahabharata is considered as Panchama Veda. That means the fifth Veda. Why? Because of the greatness of the knowledge. And four Vedas, we know, Rig Veda, Sama Veda, Yajur Veda, Atharvana Veda. But Mahabharata, Itihasa, blossoming totality is the Panchama Veda. Same thing here also, Rakta Mokshanam. Next, the sequence of events. The wise should administer. This is also technical side for the physicians. I'm not going to go into this. And the 3 steps in Panchakarma: preparation and main treatments and post-therapeutic therapies. Very important. And the need of Purvakarma. See, again, this is also a technical concept. And simply, I want to explain to you, the Purvakarma is very important success of Pradhana Karma, the main treatment. And the main treatment is very important. After that main treatment, the benefits of main treatment to be sustained by the post therapy. So that's why the Purvakarma to be evaluated, properly given in different ways, based on their pulse, based on their prakriti, based on their balance and imbalance and the nature of physiology, nature of the disease, all these things to be considered. And this Purvakarma can be from 1 month, 6 weeks, 6 weeks to 4 weeks, 2 weeks, or 10 days, 3 days, all depends on individual. So it's very technical. Importance of Purvakarma. Here it says, very interesting, I will read for you. In a vessel coated with oil, water slides down easily like wise hard stick applied oil and heat easy to bend. Like oil applied in the vessel, water very easy to slide. Like hard stick, apply some oil and then heat and easy to bend it. So same thing, physiology gets that flexibility. Flexibility means that is Daivi Guna. Daivi Guna means the divine quality of the physiology. Flexibility in the mind, flexibility in the physiology. The flexibility in the physiology is called Mardhavam. Mardhavam means malleability. Malleability means unctuousness. Unctuousness means sneha. Sneha means 2 concepts. Oiliness, sneha means friendliness. Oiliness and friendliness. So that's why this Purvakarma brings that divine nature into the physiology, that is called Mardhavam, malleability within the physiology, that flexibility in the physiology. That flexibility in the mind is one of the superior quality of the mind. Manah prasada saumyatvam maunamatma vinigraha bhava samsuddhirityat bhitite. This is the 3 qualities. Infinite silence, infinite flexibility, infinite purity within the mind is the most important character of the purity of the mind. Successive implementation of pre-treatments and the preparation of client is very essential for successive implementation of main treatments mentioned already to you. So these are the Purva Karmas, the Abhyanga, the whole body Abhyanga, and also second picture is the steam, going into the steam. Contraindication for Sneha, this is also technical concept and this will be decided by the Ayurvedic physician or the medical doctor. Contraindication for Svedana also to be decided by the medical doctors. Contraindication for oleation, number 1 is a kind of obese persons, number 2 indigestion. These 2 things, think about these 2 things. Too much cholesterol, so then you don't do oleation. And the contraindication for Svedana, if you have any diseases of hemorrhage, if you have any diseases of spreading, contagious or bleeding from nose, mouth, or any upper bleeding or lower bleeding or internal bleeding, any kind of bleedings, definitely you should stay away from it, the Svedana. So those are very simple points I'm taking. So main actions, already explained the 5 main actions. Through these main actions, 5 main actions, the 5 elements are purified because body is made of the 5 elements, Panchamaha Bhautika Shariram. The 5 elements together with consciousness, this is going to be a human physiology, simple. So how to maintain the purity within the 5 elements, how these 5 treatments contributes of the purification in these 5 elements. Emis is purification of kapha. What is kapha? Earth and water, 2 elements already purified, and chest and upper part of the body. And second one is purgation. Purgation is purification of pitta, purification of fire and water. So earth and water, fire and water, stomach, intestines, colon, middle part and to lower part of the body. Okay, purgation for pitta. Pitta has 2 elements. And purification of vata, 2 types. Herbal decoction enema, herbalized oil enema. This is vata. Vata means air and space. Now the 5 elements are completed. Air, space, fire, water, earth. All are completed through this therapeutic procedures. Now, how Basti work? That's also technical point. And now Nasya. Herbalized oil drops into each nostril. Anasahi Shirsodwaram, that means nose is the gateway to head, rejuvenates the 5 senses and also rejuvenates all the nervous system and the brain and also all the 9 nuclei of the brain stem. What are those 9 nuclei? This is a beautiful research Maharishi Ji guided to Raja Ramji, and we all know Veda in human physiology, brain stem has 9 nuclei. That 9 nuclei are the thalamus, hypothalamus, subthalamus, amygdala, and globus pallidus, substantia nigra, putamen, and caudate nucleus head, caudate nucleus tail. These are the 9 planet, the 9 nuclei are one-to-one relationship with the 9 grahas. Grahadinam jagat sarvam. So this whole universe is organized, administered by these grahas. Same thing, these 9 nuclei organized and administers this human physiology. By doing this, Nasya Karma also very beneficial effect to this 9 nuclei. How? Because if any blockages to enliven this nuclei, this Nasya Karma will be beneficial. So after this is the post therapy. This is last slide. 7 days at least one should do. What is the main thing in this post therapy? As I said, digestive fire becomes so gentle, delicate, pure, bright, and try to be enjoying its kanti, means the radiance. The Agni itself is enjoying its radiance. So you don't want to disturb that state of Agni. So the food supposed to be given day by day, increasing in solidity, and like for example, first day 1 to 14, 1 part grain, 14 parts water, 1 or 2 days, and then afterwards 1 to 4, that's called Vilepi, 1 part grain and 4 parts water. And Yavagu, there is another preparation, it's more diluted form, depends on the Agni, 4 to 64. And then afterwards, gentle, easy, and giving strength, Brahmana means rejuvenating foods to be given. So like that, very important, slow process, slow diving. So diving back to the normal activity, normal food, normal behavior, normal routine, very important. If you jump very fast, then whole benefits will be completely negated. So that's why I request you, everyone, it is not necessary you need to think about Panchakarma to be very luxurious, and also it's like a spa treatments, and also like to get elimination of all these impurities. First thing, do you have impurities? That is what is important. That is to be evaluated, and the nature of the treatments to be introduced, whether rejuvenating or detoxing or prevention treatments or rasayana therapies. There is different ways of understanding to introduce these treatments, and depends on the combination of herbs and then permutations of different formulas into these combinations. So that's why please respect to this therapeutic approach and get maximum benefit and take it serious, not just for you have some money or I want to do it, but think wisely and then take these treatments with the permission of the physician, and then also the Ayurvedic physician, one who knows the pulse diagnosis, so that it will be very beneficial to you. Thank you.